Hello, everyone. Thank you for joining us today. I'm glad to see so many of you so excited to get going. We're really pleased today to be joined by the NHS for Career Maps National Apprenticeship Week. They'll have loads of information about health careers and about their apprenticeship programs, which will be exciting for all of us, I'm sure. Just a little bit of housekeeping to start with. As a lot of you already noticed, there's a chat box next to your screen. Please drop in all your questions in there as we go along. I'll gather them up and we'll answer them all at the end of the presentation, promise. Also, someone asked about whether this is going to be recorded. Yes, this event will be recorded and will be available on Career Map Live on our website, www.careermap.co.uk in a couple days' time, so you can look at it again and share it. But also feel free during the presentation, if you see some information that you'd like, to do a screenshot so that you can go straight to the site when you're ready. Also, if you keep an eye on the chat, there will be some links dropped in as well. So you can open those pages up during the presentation if you want to look at them afterwards. But like I said, please drop all the questions you have in the chat. I promise you we'll do our very best to get through all of them. And so on with the event. Today I'd like to welcome with us both Abigail and Kirsty from the NHS. Abigail looks after the careers and Kirsty looks after their apprenticeships. But I won't steal their thunder. I'll go sit on the side and join you for the Q&A later. So over to you, lovely ladies.
Thank you very much, Sharon. Good afternoon, everybody. My name is Abby and I'm the Careers Information and Quality Lead with the Health Careers team. So Kirsty and I are going to be talking probably for about half an hour. I'll be doing a little bit, then Kirsty, and then I'll be doing a bit more. And then, as Sharon says, we'll be dealing with your questions. So please do keep those coming in. We're really, really pleased to be able to speak to you this afternoon as part of this year's National Apprenticeships Week. And we hope that whether you're joining us because you're sure that you want to work in the NHS, and you're also, really, really keen to find out more about apprenticeships, or you're just kind of wanting to see what there is out there and get a few ideas, whatever position you're in, you are very, very welcome. And we hope that you find the session really helpful. There'll be lots of signposting of resources as we go along. So, if we don't quite get through everything today that you wanted to find out, please do get in touch with our contact centre. Details of that will be going into the chat. And also, please do have a look at the various websites and resources that will be signposting for you. Okay, so we're going to be talking about several different roles within the NHS and various different apprenticeships that there are. The really important thing to remember about all of them is that no matter what role you do in the NHS, you are making a difference to people's lives. And that's a really, really vital thing to hang on to, that whether you are working in an office and don't actually have contact with patients at all, or you are actually there providing that hands-on patient care, you are making a difference. And that's a really exciting thing about working for the NHS. Okay, so what we're going to do, a little bit of background and context, talk about some of the sort of areas of roles that there are in the NHS, talk a bit about some of the terminology that we might use, and then Kirsty's going to be talking about what an apprenticeship is, which ones are available in the NHS, and how to apply, and we'll be giving you some top tips and some more resources. So, in terms of background and context, the NHS delivers its healthcare through more than 1,000 organisations in England, and each one of those organisations is an employer in its own right. And the reason we tell you that is because there can be real variation between those organisations. Some of them might be offering, for example, registered nurse degree apprenticeships. Another NHS organisation just down the road might not be offering those yet. So it really does depend what the workforce needs are, what the priorities are within those different NHS organisations. So it's really important that you listen to sort of the tips that we give you about how you can go about finding out whether your local NHS organisations are delivering apprenticeships and the apprenticeship that you want to find. Okay, so just a little bit of terminology then. So we talk quite a lot about non-clinical and clinical roles. So just to make sure that everyone understands the difference between the two. So non-clinical would be the sorts of roles where you're not actually caring for patients directly. You're not providing that hands-on patient care, but your role is just as important because we need all these roles to make the NHS work effectively. So the sorts of roles that would fit into the non-clinical group would be things like administration, finance, management, estates. So that's kind of the looking after the building and grounds and things, housekeeping, and some of the healthcare science roles that are very laboratory based, and many others as well. And then clinical roles are the ones where you are delivering that hands-on patient care. And those sorts of roles would include healthcare support workers, nursing, operating department practice, radiography, orthoptics, and the psychological professions, and many others. That's not a complete list, but that's just to give you an idea. If we talk about clinical or non-clinical, that's what we mean. Okay, so these are the groupings of the various roles within the NHS. So as you can see, several different groupings. And actually, all of these groups, apart from doctors at the moment, do have apprenticeships available within them. So I'm just going to very briefly talk through so that you know the sorts of roles that we're talking about within each of these groups. So the allied health professionals are a group of 14 different professions. And the majority of the roles within the allied health professions are very much focused on enabling patients to live the best possible life they can within the constraints of maybe disability or disease or an operation, for example, but really focusing on getting the patient to be able to do as much as they possibly can and enjoy life as fully as possible. So those roles include things like speech and language therapists, podiatrists, paramedics, operating department practitioners, and many others. Then we've got the ambulance service team, and this isn't just about the paramedics because you've got the call handlers and the emergency medical dispatchers as well. So again, that difference between the paramedics who are there providing that hands-on patient care and call handlers who are sitting in front of a screen and on a telephone and providing care and support in a very different way. And the dental team, so again, not just about the dentists, but we've got the dental nurses, the dental technicians, the therapists and hygienists as well. And then doctors and their 60 plus specialties within that. And then the health informatics team. So this is all about using data and making sure that we've got really good quality data that's analysed properly and used well so that we can improve patient care at the end of the day. Healthcare science. And I think because of the COVID pandemic, I think a lot of healthcare science roles have really come to the forefront over the past year. So we've got roles in healthcare science that are very laboratory based, but there are other roles where you're much more patient facing and they're helping diagnose and treat problems that patients may have. Management then, and that's all sorts of management, whether that's about managing money or people or buildings. And then the medical associate professions, that's a very small group of staff, includes roles such as physician associate, which there is now an apprenticeship for as well. And then midwifery. So this includes, the midwives themselves in the different areas that they might work in and the maternity support workers that are going to be supporting them. And nursing with the full field. So I think nursing is one of the ones that people know a bit more about. So we've got adult, mental health, learning disability and children's nursing, and apprenticeships available in those, which I'm sure Kirsty will talk a bit more about later. And again, the pharmacy team, so not just the pharmacists, but pharmacy technicians as well, and pharmacy assistants. And the psychological professions, which is a really growing group of staff that's very much there to support the various mental health challenges that we have as a society. And this group of staff is really growing, both in terms of the sorts of roles there are there, but also in terms of numbers of staff as well that we need. And public health as well has very much come into the spotlight over the last year with the management of the pandemic. So if you're really interested in science and people and how they behave and want to put those interests to helping to improve the health of our society, then public health might be something you want to look into. And then finally, but definitely not least, the wider healthcare team, which is a term that covers many different roles within health, whether that be healthcare support workers or maintenance staff, housekeeping staff, all absolutely vital roles to helping to look after patients at the end of the day. So I know that's an absolute whistle-stop tour of the various things available. Kirsty will I'm sure, pick out some of these and talk more about some of the apprenticeships available in a bit. Okay, so you can get into the NHS at various different points. And obviously today's session is all about apprenticeships. But just so that you're aware that there are many different ways that you can get in, whether that's at an entry-level role or after you've done a course at a college, for example, after a degree, or maybe after postgraduate training, or you've worked somewhere else in a completely different sector for years and years and are wanting to make your move into the NHS. And we welcome anyone at whatever point they're coming in, because people are going to be bringing different things, different experiences. Okay, so I'm going to hand over to Kirsty now, who's going to talk to you more about what apprenticeships actually are.
Thanks, Abby, and hi everyone. So I just want to talk a bit about what an apprenticeship actually is. And I noticed that people have been talking in the chat as well. So to just reiterate to everyone, an apprenticeship is basically a way of learning while you earn. So you are an employee, and you are mainly an employee, but you have some of your time dedicated and protected for learning. So as you'll see on the slide, it says 80% of your time is on the job. So that's where you are operating as any other employee would and doing your job and being paid for all of your time. And 20%, which is also paid time, is protected for learning. So that might be in a classroom, or it might be in a different part of your employer doing different kind of training. You might be shadowing somebody, or you might be doing a course, or you might be doing all kinds of different types of learning. But that is protected time within your job so you can improve your skills. These roles are paid, and the legal baseline is the National Minimum Apprenticeship Wage, and we'll be talking a little bit about more pay in the next slide. And they are for a set period of time. So different apprenticeships exist at different levels, and each of those are a different duration of time. So the minimum is 12 months, but they can go up to 6 years. They're open to everyone over the age of 16. There is no upper age limit, and you can often achieve a qualification as part of an apprenticeship as well. So we said a little bit about pay, and so I just wanted to say a bit more about this. As Abby said at the start of this presentation, the NHS is a big body of organisations, lots of different employers. Some of those are hospitals, some of them are GP surgeries, some of them are care homes. There's a real wide variety. So it makes sense to look at your various local employers where you live and find out what the normal practice is going on around you. But we can say that most NHS employers pay above the national minimum wage for apprenticeships, and many pay a lot more than that. The NHS pay system starts at £18,000, and that's for the most junior roles. So if you went into a job that wasn't an apprenticeship role, that's where you would expect to start. For apprenticeships, because they're a combination of working and learning, often employers will pay 70% of the standard wage. So you might be looking at starting at somewhere between £15,000 and £20,000 for various different roles across the NHS. We're going to be circulating these slides after today's event, and there's a link in that slide that shows you the full pay scales so that you can see where you might be going into your career and where you might be able to progress onto. Because there are 350 different jobs in the NHS, there are loads of different opportunities and loads of different pay scales. And over 100 of those jobs are available through apprenticeships. So there's a real range, and you can have a little look around in your own time for a bit more information on that. So just to say a bit more about what apprenticeships are available within the NHS, I said there are over 100. And as Abby mentioned before, there are clinical roles, so patient-facing roles, and non-clinical roles, so those are which are not patient-facing. And just to give you an example, Abby and I both work within the NHS, and we work in non-clinical jobs. So there are all kinds of things that need to happen to support the NHS that we know and love to do its job. They're from all different levels. So from level 2, which is the equivalent of GCSEs, right up to level 7 as a master's level, and all the steps in between that. They happen in lots of different settings, as I mentioned before. So within a hospital and within different departments of the hospital. And as Abby mentioned, these vary from places to place within the country. They happen in GP surgeries, they happen in care homes, they happen in offices and out in the community. There's a real wide variety of roles. So just to give you a snapshot of some of the things that are out there or have been out there recently, this slide shows you some of the apprenticeship vacancies that have been advertised over the last 3 months. So these are from across the country. You can see from right down in the southwest of England, right up to the northeast, and a real mix of different roles. So there are ones in there that you might expect to see in the NHS. So things like a nursing associate, which is a patient-facing role. If you haven't heard of the term nursing associate, that's because it's a relatively new type of job title, and it represents an interesting role between a healthcare support worker, which is an entry-level role, and a nurse. So it's a middle role there that didn't used to exist, but exists now and exists as an apprenticeship. And then there are other ones that you might not be so familiar with. So for instance, we have in here a apprentice electrician. So we have all kinds of jobs like that within the NHS to keep the service running. So all kinds of things around computing, estates and management that Abby mentioned before, running the sites and the buildings, and all kinds of operational work that happens to keep the service running. You can see we've got things like dental nurse, pharmacy technician, and also psychological wellbeing practitioner, which is how you can do psychology as part of an apprenticeship in the NHS. So to give you a little kind of flavour of some of the ones that exist, here is a selection of some of the apprenticeships that exist within the NHS. So level 2, as we mentioned before, is the equivalent of GCSE. And at that kind of level, you can do healthcare support working, you can work in finance as an assistant, you can work in pharmacy services as an assistant, all available as an apprenticeship. Going up to level 3, so that's the equivalent of A levels, we've got ambulance support worker, digital support technician, and prosthetic and orthotic technicians. So those are people who work helping people who have had amputations or particular work around feet. So all very important services to patients. You can see there level 4. So that's the level above A levels, but just below a foundation degree. So there's work in mammography there. So that's a type of radiography that works in breast screening. An oral health practitioner, associate program manager. A lot of work can happen across these levels. Level 5 is foundation degree. So that's the first year of a degree. And that's where the nursing associate that I mentioned before sits. And there's other roles there, like the health play specialist. So if you're interested in working with children, then that might be something that you're interested in. Level 6, so degree level, is a registered nurse and also environmental health practitioner. There's also a lot of other degree level apprenticeships that exist and you can be employed in now. And then going to the top level, masters, there are senior leaders, so management, an important role within the NHS, and psychology roles as well. So we mentioned degree level apprenticeships before, and there are a couple of examples on that slide. Here are more. As you can see, there's lots of them. And there's a link in this slide that you'll get after this presentation today, which will take you to the whole list of them if you really want to look through the degree level options. But just to give you a bit of a flavour, so speech and language therapist is available as an apprenticeship, occupational therapist is available as an apprenticeship, paramedic, physiotherapist. So a lot of roles that you will have heard of or probably have, you know, been in contact with in some way, and others that you might not know so much about. So dietitian, you could read up a little bit about that, or a therapeutic radiographer. Lots of really interesting patient-facing and non-clinical roles too. So As you're thinking about your career, and not just the way that you want to enter the NHS, but what you might want to do as you progress through the NHS. And we really like to retain people within the NHS when they work with us. So working in the NHS is not just about getting a job and then things stop there. We really invest in lifelong development and lifelong training and learning. So this can show you where you could aspire to go. So for instance, if you look at the middle row here, we have a career pathway around nursing. So you could come into the profession as a healthcare support worker, which is at level 2, and that's something you could do at 16 or at a later point, but coming in at that point is a level 2, and then progress onto a level 3 senior healthcare support worker. Then you could progress onto being a nursing associate, and then you could be a registered nurse. And those are all available purely done through apprenticeship. So purely as jobs where you get paid and you also get trained as you're getting paid. If you'd like to know more about the career pathways that are available through apprenticeship routes, then this link on the bottom of the slides will take you to that. Okay, so if you're interested in this, how would you like to get on and get involved with it? Now, we're going to talk a little bit about our website, NHS Jobs, and Abby's going to tell you a bit more about that. But I wanted to say, as well as NHS Jobs, there are other ways to get into the sector and get into apprenticeships in the NHS. So a lot of apprenticeships are advertised on NHS Jobs and you can apply for them there, but also a lot are recruited to from within the existing workforce. So you could enter the workforce through either an apprenticeship job or a non-apprenticeship job and find an apprenticeship once you're within the sector, either working for a hospital or working for a community organisation or a GP surgery or whatever. So there are lots of different ways in. So for instance, if you wanted to become a nurse, you could start as an apprentice nurse, but if those options are not available in your particular locality at the moment, then I would really advise becoming a healthcare support worker, either through an apprenticeship if it's advertised in your area or not, and then progressing through that way, because you may find that options open up a lot more once you're within the workforce. And so look at your local employers, look at the local area, see if there are alerts that you can sign up for from the hospital, the local GP surgery, the local care board, and that might be a good way of finding out what's going on in your area. Okay. So this is the NHS Jobs page, and this is where I'm going to be handing back over to Abby to give some advice on navigating NHS Jobs.
Thank you, Kirsty. So yes, lots of information to be taking in here, and yeah, really important, as I mentioned earlier, and as Kirsty's been saying, to think about the different ways that you can go about finding out what opportunities are available for you locally. So the NHS Jobs website is where all NHS vacancies are advertised. So that will be apprenticeships and non-apprenticeship jobs as well. So the web address there, so it's jobs.nhs.uk, and also on the government Find an Apprenticeship website. So NHS vacancies for apprenticeships should also appear on the government website and vice versa, but we would recommend you check both just in case any fall through the gaps. Okay, and so the NHS Jobs website in a little bit more detail. One really helpful thing to do, and I can see that this has been, we've recommended this in the chat already, is to register with NHS Jobs. And then what you can do, you can set up email alerts so that you receive an email when a vacancy is advertised that you are particularly interested in. So say, for example, you look on the lookout for a healthcare support worker apprenticeship. You can use the search bar there to search, and you might want to put just apprenticeship in or apprentice and then filter out the ones that you're interested in, or try putting healthcare support worker in and see what that brings back. But a little bit of a word of warning, unfortunately, because of all the different organisations that make up the NHS, they can also call jobs slightly different names, even when it's the same job in another organisation. And I'm just going to give you an example, and this is from today on NHS Jobs. And these are all healthcare support worker apprenticeships, but this is what they were called on NHS Jobs. So one of them was called trainee healthcare assistant, one was called clinical apprentice in health, and one was called apprentice health and social care support worker. So just to give you an idea that it can sometimes be tricky to find what you're looking for. So just keep persevering, try out different search terms, see what it brings up, and just keep looking and filtering down. But the email alerts can be a really good way of keeping track. So there is the simple search facility there where you can just put in keywords, as I said, like, for example, clinical support or healthcare support. And then there's more of an advanced search feature. So here you might want to put in your postcode or where you live, and then you can search within a set number. So you might want to search only within 10 miles of where you live, for example, or you might have, you know, good travel options and you can look a bit further afield. So that can be a really good way as well of finding vacancies. In the middle there, you can see advice for job seekers. So there are hints on applications and interviews and things to help you prepare, which can be really useful. So we do recommend that signing up with NHS Jobs is a really helpful way. But as Kirsty said, do as well feel that you can make contact with your local NHS providers and get in touch with them directly to see what they've got coming up and what opportunities they might have. Okay, so just a few useful things to know. So you can apply for more than one apprenticeship at a time. It's like applying for a job, so you can have more than one application on the go at once. The apprenticeship does need to be significant new learning for you. So it can't be something that goes, so say for example, you're someone joining us today who's already got a degree. That doesn't mean that you can't go off and do an apprenticeship, but it would need to be significant new learning and not going over everything that you've already covered on your degree. For those of you that are joining us and thinking, oh, well, I haven't got my maths and English GCSEs, I'm not going to be able to do an apprenticeship. The brilliant news is that just isn't true. You can still access some of the apprenticeships in the NHS, and you will have the option on some of those apprenticeships to gain your maths and English qualification while you're doing your apprenticeship. So again, that's something that you might want to talk to that particular employer about. And then, as Kirsty said, you know, contact the training department of the, you know, local NHS trust, for example. Speak to your line manager if you're already working in the NHS, and potentially speak to the education provider as well. Right, values-based recruitment. This is really, really important. So if you want to work for the NHS, then it's vital that you share these values, because these are the values from what's called the NHS Constitution. And as you can see, there are 6 different values there, and these are just as important as your academic qualifications in terms of gaining an apprenticeship or a job with the NHS, because we need people who share those same values, because that will mean that we have much higher chance of providing that really high quality patient care at the end of the day. So think about, if you're writing a job application or apprenticeship application or going for an interview, if you were asked to give examples of how you demonstrate these values in your life, have those examples ready. And you can draw these examples from any part of your life. So think about your home life, your school or college life, or if you're already working, think about that. Do you have a Saturday job? Have you done some work experience or volunteering? Because it doesn't matter where your examples are coming from. What matters is your ability to relate your life experiences to demonstrate that you hold these values. So these are really important, and we really recommend you go away and have a bit more of a look at these afterwards. Okay, so work experience. We do know that this is, it's always quite difficult to get work experience in health, but at the minute, because of COVID, face-to-face work experience just isn't happening. But employers and course providers do know this, so they are being much more flexible. So please don't worry and think that because you can't have work experience at the minute, that means you're not going to be able to progress, because there will still be opportunities too. So as I said, think very broadly. Think about how you can draw on experiences. You know, if you work in a shop, you're dealing with customers, that's customer service, and you can apply some of that to demonstrate that you have the NHS values. You might work for a charity perhaps, or help out in a care home, or maybe you've been helping out an elderly neighbour with shopping, for example, over the last few months during the pandemic or before. So just think about any way you can that helps you to evidence that you're the right sort of person for the job. And have a look online as well, because we are seeing more and more sort of insight experiences, also virtual experiences that are helping to give people a little bit of a picture of what it's like to work in health. Okay, so the Health Careers website, this will be a great resource for you after this session. If you're not already familiar with it, spend some time having a look through it, because there is so much information on there, and it'll really help you to narrow things down and start to make decisions about the sort of route you want to pursue. So I've seen in the chat already that the Career Finder quiz has been mentioned, and that's a really great way of starting to get some ideas if you need ideas of the sorts of roles that might suit you, or to help narrow it down if you've got already got a few ideas and just want to pinpoint it a bit better. So we've got the Working in Health tab, the main tabs across the top there, the Find Your Career, and that's where you'll find the quiz, the Explore Roles section. This bit has got the different roles within the NHS grouped under those categories that I talked about right near the start of this talk, and each role has got a page of information. And so have a look at that, because that will tell you more about where you might work, the sorts of things you might be doing, who you might be working with, and more about entry requirements and progression opportunities. If you see the A symbol, the capital A symbol on that page, that means that there's an apprenticeship available in that particular role. So lots and lots of information there. You can register for an account with Health Careers as well, and that'll mean that you'll receive targeted emails about the particular roles that you've expressed interest in. And there's lots of other information on there as well, so have a good dig around. So the Find Your Health Career tool I've already mentioned, so it's a series of statements, and depending on how you respond to those statements, the tool will then bring up some suggested roles, and then you can click into those roles and it will take you to the role page and where you can find out more. So it's a really, really useful way of, as I said, of getting some ideas and finding out more. We've also got the Step Into the NHS website, and this is aimed at key stages 3 and 4. So there are some real life examples of work experience placements there. There's another Career Mapper quiz as well, so a slightly simplified version, which you might find really helpful to have a go at. And if we have got any teachers or careers advisors on this webinar today, then there are lots of resources for you as well, and information about our schools competitions, so do have a look. And the NHS Jobs website has also got a really useful page under the Browse Jobs tab, which brings up a directory of employers in the country. So as Kirsty has said, do get in touch and find out if your local NHS employers have got plans to have, if you've got a particular apprenticeship in mind, then get in touch with them. And this page of information can be a really useful way of getting their contact details. Okay, so if you want to find out more, there are loads of questions coming in, which is brilliant, and Kirsty and I will be answering those shortly. There are our website addresses there, and also the NHS Jobs website and the government website, and also Amazing Apprenticeships, which some of you might already be familiar with. The final web address there, the HASO one, is the one that shows the progress of all health-related apprenticeship standards that are currently being developed. So you can have a look at that and see if there's a particular apprenticeship you're interested in, and you can find out whether it's already been approved or whether it's in discussion, for example. And there are some pathways as well. So Kirsty showed you some pathways earlier. You can find more of those on the HASO website as well. So thank you all very, very much for listening. We are going to end the slideshow there and get through your questions.
Brilliant, really informative. I hope everybody who is our guest today are paying close attention, because quite a lot of those questions that have come up in the chat have been answered. But if you've just joined us, we might do a little bit of a recap. And Abby, I might even ask you to show one slide again, if it's not too challenging, because we have had an awful lot of questions that have come through about, can I do an apprenticeship in this? Can I do an apprenticeship? Can I do an apprenticeship? And one of your slides actually was a nice graphic of all the different areas that you could do the presentations in. Is that going to be a bit of a challenge, or we?
No, let me try and dig it out.
And while she's digging that out, sorry, there were, oh, here we go, excellent. I think it was a few slides back. While she's getting this slide up, everyone, for all of you people who were talking about and asking questions about specific areas that you're interested in, when we get to this slide, it's a really good plan for you to do a screenshot so you can have a look at the different types of apprenticeships that are available. So here, oh, go on.
Oh, so I don't know.
No, keep going. The one that had you had all of them listed, didn't you? Yeah.
Oh, the one that listed the different groupings of staff.
Yes.
Right. Yes. So this one.
That's the one. Right. So for all of you who've expressed an interest and asked, like for instance, Owen just asked now about sports rehab. We had quite a few things about clinical psychology, IT, electrical, midwife. So there were all sorts of different types of apprenticeships and careers available. So it's a really good idea to take a screenshot here, and I see that we've also just popped into the chat box that there's a specific link for psychological profession careers, which is great. You can go and look at those specifically. Interestingly though, we did have a couple of questions about things like IT and electrical. Are these things available as well?
Yes, is the quick answer. So I just turned my camera off so that people could screenshot because I was aware I was in the corner there.
We can stop the presentation now as well if you like.
But yes, the quick answer is that those non-clinical roles that we were talking about before, there is a lot of opportunity for apprenticeships within them. So a lot of administration roles within the NHS are apprenticeship routes are in business administration at different levels. But equally estates and management, so electrical work, certain types of plumbing work and all those kind of roles that you might not necessarily associate with the NHS do exist in certainly different parts of the NHS, not maybe in every single employer and not maybe in every single region of the country. But certainly if you're interested in doing that kind of work and interested in doing it in the NHS, you will be able to do it. Yeah.
That's really really good, and it's a point that we often make in Career Map and in our Career Meg publications, is that, for instance, with IT or even accountancy, you don't have to go work for an accountancy firm. If you've got a passion for healthcare, you could do those things in that area as well.
Absolutely.
Now, we did have a question that just came up that is kind of, I do want to touch on. Somebody asked about apprenticeship for with people with disabilities or special educational needs.
So the different ways in, I mean, the first thing I would kind of think about is nursing. So you can do nursing, and your specialism would be in learning disability. So that is a recognised profession. You can do that as a non-apprenticeship route, but you can absolutely do it as an apprenticeship route as well. And actually there is a drive to get more learning disability nurses via an apprenticeship. Well, in general there is, but via an apprenticeship route particularly. So do look around in your local area to see that. But equally there are other roles like health play specialist. There are ways that you can contribute to the support for people with learning disabilities, even from behind a desk. So not all of those roles are patient facing, and, you know, administration and management is really important to delivering those services. So I have colleagues who work, as we are all now, at a desk behind a screen at the moment, hopefully after COVID in real life as well, and really support the delivery of care and learning for people with special needs, but aren't in patient facing roles.
Great.
We've also, Charlotte's just, sorry,
can I just add as well, so roles like occupational therapy as well and physiotherapy, where you could really then go and specialise with learning people with learning disabilities. So yeah, as Kirsty said, lots of ways of working with that particular group of patients.
Thank you very much. We've had quite a lot of questions around the university apprenticeship sort of space. So I'll sort of summarize them and then we can kind of talk about them as a theme. For instance, Charlotte just asked, and this has come up a couple of times in the chat, I've applied for university too. Can I still apply for apprenticeships if I have pending applications? There were a couple of questions about what's better, doing a degree apprenticeship or going to university. And there was another one. Are you more likely to get a job if you have done an apprenticeship as opposed to doing a degree? So there's lots of different kind of angles on this. Before you start, I will say that just to clarify for the young people out there, whether you do a degree apprenticeship or any level apprenticeship, there is a level of learning to a level of qualification. So you will maybe going to a college or working, as was mentioned, with an education provider. So that might be a learning provider who you will study, but then you are working and it's a real job. But back to the wider university question.
So it's a really common question. And the first thing to say before anything else is that a degree achieved through full-time study and a degree achieved through an apprenticeship are the same thing. So they are exactly the same academic qualification. So if you, for instance, became a physiotherapist by going full-time to university, and you became a physiotherapist by mostly working with your study on top, you are the same qualification, same degree, you are recognized exactly the same way. So that's the important thing to know, that there is no difference in those two things. In terms of what makes you more employable, that's a very interesting question, and will depend on where you are and the kind of role you're looking at. I would say that often people, and this is not exclusive to health, people often like to recruit people they already know. So the advantage with apprenticeships is that you are already in your workplace doing your job, recognized as such. And we know that there is a much higher uptake in nursing, for instance, of apprenticeship qualified graduates than the other traditional roles of applying for nursing. So there's all kinds of discussion to be had around this. And I'm not saying that if you do an apprenticeship, that makes you 100% more employable than if you did a normal route degree. It's, far too wide a field to say that, but there are advantages to both routes, and they should be seen in that way, I would say. Yeah.
Excellent. And we've got Paige asking there about entry requirements, and Abdullah asked if you get 3 GCSEs, can you do an apprenticeship? I think there is some clarification that probably needs to be done about A-levels, type of A-level subjects, GCSEs, and what that means for doing an apprenticeship.
So I would recommend back to the tool that Abby showed on her slides, where you can take the questionnaire for yourself and see what roles you like, because when we're talking about apprenticeships or any jobs, we're talking about so many things at the same time that it makes sense to look at the areas that you're really interested in. So if you take that quiz and look at the areas that it presents you with, then it will show you what requirements are needed for each of those individual roles. And it's a really great tool. I would really recommend spending time on that, because then you'll know exactly what is needed for each of those things and how you can get into them. As a big statement across all apprenticeships, there will be something that meets your level of learning. So even if where you're looking to go eventually is not where you are now, there's a way that you can get into that role by earning and learning and then working your way up. So whatever your end point is, you can either study your way there, or you can work your way there, or you can do a mix of both.
Thank you very much. I can see that again that we've had quite a lot of questions, so it's probably a good idea to revisit this, where quite a few of them have been talking about, I guess it's really the process of recruitment for apprenticeships, in that when you apply to go to university, you get to the autumn, you do the UCAS process. It's very clear when you're going to be, that process is kind of static. Mm-hmm. But an apprenticeship are different, aren't they? Do you want to expand on that?
Yeah, sure. So there is more flexibility, as you mentioned. So some things do tend to align with the academic year as well. So you often will see recruitments at the same time that universities are recruiting. So kind of September, January, often there are cohorts, but it's a lot more flexible in the apprenticeship world. So you are not tied to those big deadlines. We know that people are recruiting right now for all kinds of apprenticeships, and that will continue throughout the spring and the summer. So it's just about being more aware of the places you'd like to study, because there'll be study as part of your apprenticeship, and the places that you'd like to work, and what their, you know, when their kind of cycles are and when they're advertising. Yeah.
Super, thank you. So on the line, you mentioned already about us being online here now. So the world of COVID is obviously, particularly in the day-to-day experiences of the workplace in the NHS, but with training and being online and the face-to-face and blended learning, what sort of impact and how is the NHS responding? And I presume it'll be differently for different qualifications, but
Abby, I don't know if you want to say, I mean, I can say some more about that as well, but I'm aware I'm kind of hogging the space.
No, it's fine. You can go ahead with that one, Kirsty.
Well, so there is a lot of stuff still happening, and we're trying to keep as many people on programme as much as possible. And, you know, some of the universities and the training institutions have responded really, really well to COVID and have been able to keep people in their learning, keep people in their work. In some situations, it has impacted, obviously, as you would imagine, and some apprenticeships have been paused. So you have something called a break in learning, which means you don't have to finish your apprenticeship, but you can take a pause. And that has affected some apprentices, particularly if they've been asked to move to the front line or be redeployed into different types of roles. But equally, as you mentioned, COVID has meant that a lot more online learning has taken place and has improved, actually. So there's a lot more functionality and different types of blended learning that weren't in place this time last year. So for the most part, I would say, don't think that it's cancelled or that things are off. It may be that things are being done in a slightly different way, and it may be that things are slightly further back than they would be. For instance, work experience at the moment is really tricky because a lot of hospitals obviously are delivering their care to their patients, dealing with the pandemic, supporting their learners, supporting their apprentices. Sometimes finding space to give work experience placements is really tricky at the moment, but lots of NHS employers are offering different alternatives. So they might be offering online alternatives or study support or aspiring to do something in the future. So, and they want to keep people in touch. So even if there's not something available right now, they'd like to hear from people to register their interest for future, opportunities. Yeah.
We did have a follow-up question on there. It says, if I was supposed to do an apprenticeship right now, do I have, oh gosh, the questions are going so fast, I almost lost it, there it is. Do I have to wait until the virus goes, or can I still do it? So I guess what you're saying is...
No, absolutely not. So the point I made earlier about getting into the healthcare workforce really stands true in this particular space. So there are apprenticeships being advertised at the moment. If you go on NHS Jobs now, you'll see them. But equally, if the one that you're after isn't quite there, then it might be that particular hospital or that particular employer is having, is dealing with so many things that they're not offering it right now, but they'll be offering other opportunities. So there might be a parallel kind of job that is either an apprenticeship or not an apprenticeship, or a slightly more junior role, an entry-level role that you could get into and be in the right place, so that when, hopefully, when the pandemic lessens slightly, you'll be in a really good place. You'll have lots of experience. You'll know the right things. You'll know the right people to get into those opportunities that are advertised then. Yeah.
I do have a question for Abby, though, and I think this is more for clarity for our audience, which some of them sound to be a bit young, talking about GCSE and A levels, and they may not really understand. Young people understand, obviously, with everything that's been going, what the NHS is, but then we talk about local providers, and perhaps you maybe could just explain for our young audience what we mean by, yes, you're applying for the NHS, but then you're paying for, applying for the hospital down the road, so they can understand, what that fits into.
Yes, of course, and it is confusing. So it is. So the NHS is umbrella organisation almost, and then within itself, you've got as Kirsty mentioned, you've got GP surgeries, you've got and other kinds of providers of NHS care. So it's a separate organisation, and each of those will, which apprenticeships it's going to have, how many it needs, how many administration staff it needs. A hospital.
Oh, Abby, I think your voice, your sound's cutting out a little bit.
Oh,
or is that me?
I think there's quite a lot of breathing noise coming in. I don't know. So, for example, you might have a hospital just down the road from you, and that hospital might be part of what's called an NHS trust, which might be several hospitals grouped together, maybe 2 or 3 hospitals grouped together to form an NHS trust. So, for example, I've got a hospital quite near me called Stoke Mandeville Hospital, but it's part of a wider NHS trust called Buckinghamshire Healthcare Trust. And if I was applying for a job there, I would apply to that NHS trust. Now, the good news is that all of those different organisations I've just talked about will advertise their jobs on NHS Jobs. So you can go to one place to look for the jobs. As Kirsty mentioned, the individual organisations will often have their own, well, they'll have their own website, which will have their vacancies on it. But if you want to see all NHS vacancies in one place, then NHS Jobs is the place to go to. That's probably the simplest way of putting it, but it is confusing because there are all these different organisations, but they all employ NHS staff. I hope that's helped.
I hope so too. I think it makes sense, but I do know that sometimes young people, other than maybe having got a jab or something, that they may not ever have been really very frequently, and to understand that relationship I think is really important. Coming back to about being a job, Charlotte quite rightly asked, and I think again it's something that needs to be clarified, is that as you said, it's like having a regular job. So will you have holiday, sick pay if one becomes ill, or is it term-like universities?
No, so really good question. And yeah, it is a job like any other. So all of those other benefits that you get with employment, you get them with an apprenticeship. And in the NHS, those benefits are very good, actually, like particularly compared to other sectors. So that means that generally pay is higher than other sectors. It's mean you have protected sick pay, you have protected things like maternity pay, you have time off, annual leave. All of those rights that you get as part of employment are also applied to apprenticeships. So you can expect that level of everything, and and it's not like a student where you're on and off, and you're an employee. Yeah.
Super. Well, I think we're kind of running out of time, but I do think that there have been a load of questions that have come in. Oh, one last one I did just see pop by, which I did want to talk about anyway. But they talk about age limit, which I think a lot are thinking young, but also older. I think is really important to say something about that too.
Yeah. So a little while ago, a few years ago, there were limits on the age that you could do apprenticeships, and there were certain restrictions, but that is no more. So if you're 16 or above, you can do an apprenticeship. There is no upper age limit. There is nothing below that age limit either. In different hospitals and different settings, they have certain rules on who can be on wards. So there are some hospitals that say if you want to be doing certain care in certain wards, you have to be 17 or 18. But that, again, depends on the particular place that they're working. In terms of apprenticeships in general, the only kind of consideration you need to think of is what you've previously studied, if you've previously studied anything. So if you have a degree in something, then your apprenticeship has to be significant new learning. So if you have a degree in nursing, you can't do an apprenticeship in nursing. But if you had a degree in biology, for instance, and there was enough difference between the choice of nursing that you wanted to do, or if you had a degree in English but wanted to do nursing, then you could definitely do that.
I think that's really important because I think it's for anyone out in our audience there that are an adult learner as well, or a career changer. Now is a really good opportunity to have a look at what's out there. So as a recap, there's 4 things that I think, given the kind of feel of the kind of questions that comes through, that in case they maybe didn't pick it up on the presentation or the chat, that I think would be worth going through. So we did talk about going on the NHS site to seeing all the vacancies, but also looking at the local provider, healthcare provider. Now, you mentioned about the NHS site again. I think if we might want to pop that in the actual chat so people can click on it. So for everybody who's watching, this presentation has been recorded and it will be available on CareerMap Live and on our website, www.careermap.co.uk. And as our team at the NHS has just put in, if you have any questions, they've got a phone number that you can ring and also a website there. But if you want to watch this again, you're welcome to come back to our website and a few days after we have a chance to edit it and get it up live, and feel free to share it and view again. And one more thing I think was really interesting and quite different, because I think it is a bit of a challenging world out there, and there have been so many questions about A-levels, GCSEs, qualifications, but the point that you made about value-based recruitment, I think is something just to reiterate for people listening. So if you want to give a little recap on that, and then we'll wrap up.
Yeah, of course. So have a look, if you Google the NHS Constitution or just Google NHS values, or go onto our website and find them, you'll see those 6 values, and really think about your life experiences from whatever area of your life, and think about how you can provide evidence that you understand those values, you know what those values would mean in the workplace, how that would mean people will behave, and that you're able to give examples of when you've demonstrated those values as well and what they mean to you.
Absolutely. Brilliant. And I think there was quite a lot of questions about CV writing, and I can see that in the chat now. We just dropped in the sort of values in the Constitution, and I think for CV writing, if you haven't had any special training or thoughts about CV writing, one of the things that you should always do is match your life experiences or your work experiences, if you do have them, against the requirements of the job. But in this case, it's particularly important and it's well worth the visit. So thinking about CV writing, that's an excellent tip that hopefully answered quite a lot of your questions. Sadly, the questions are still pouring in, but thankfully we did get the number on there, so quickly scroll through, make sure you open that up on your tab on your site so that you can have a look at that again and get in touch if you've got specific questions. Really informative session. I really would like to thank everybody who's taken the time to come and sit with us for the hour. I hope you've enjoyed it and found it useful, and I would like to say from CareerMap, it's Sharon, thank you for joining us, and from the NHS,
thank you.
Thank you.
Great. Take care, everyone. Have a really good afternoon. Goodbye.